What is anti-CCP and seronegative Rha? Have you ever wondered what anti-cyclic citrullinated peptide antibodies, or anti-CCP, mean in the context of rheumatoid arthritis? These antibodies are specific immune proteins that can often be found in the blood of people with rheumatoid arthritis. They target proteins that have undergone a chemical change known as citrullination, which is frequently seen in joints affected by rheumatoid arthritis. The presence of anti-CCP antibodies is a strong indicator for diagnosing rheumatoid arthritis and can even appear years before any symptoms show up. However, in the case of seronegative rheumatoid arthritis, these antibodies are not detected in the blood, even though the patient may exhibit clinical signs of the disease. Rheumatoid arthritis is typically categorized into two main types based on blood test results: seropositive and seronegative. Patients with seropositive rheumatoid arthritis test positive for anti-CCP antibodies and/or rheumatoid factor, while those with seronegative rheumatoid arthritis test negative for both. Anti-CCP antibodies are considered more specific for rheumatoid arthritis than rheumatoid factor, making anti-CCP testing a preferred diagnostic tool. Research indicates that about 60 to 80% of rheumatoid arthritis patients have anti-CCP antibodies. However, around 20% of patients are seronegative, meaning they do not have these antibodies despite showing symptoms of rheumatoid arthritis. In cases of seronegative rheumatoid arthritis, the absence of anti-CCP antibodies does not rule out the disease. Diagnosis relies more on clinical evaluation, imaging studies like X-rays that can show joint damage, and other laboratory tests. Even though seronegative rheumatoid arthritis can present similar symptoms and joint damage as seropositive rheumatoid arthritis, it may be more challenging to confirm early on due to the lack of blood markers. Anti-CCP testing is highly specific, with about 95% specificity, but its sensitivity is moderate, ranging from 53 to 71%. This means that while a positive test strongly suggests rheumatoid arthritis, a negative test does not exclude it. Therefore, if a patient shows symptoms of rheumatoid arthritis but has a negative anti-CCP test, doctors may consider the possibility of seronegative rheumatoid arthritis and will likely use additional diagnostic methods. In summary, anti-CCP in seronegative rheumatoid arthritis refers to the absence of these specific antibodies in the blood, even when clinical signs of rheumatoid arthritis are present. This distinction is crucial because it influences both diagnosis and treatment decisions. Seronegative rheumatoid arthritis is still a confirmed diagnosis based on symptoms, physical findings, and imaging rather than solely on antibody tests. It is essential for individuals with seronegative rheumatoid arthritis to receive thorough evaluations and monitoring from a rheumatologist. The disease can be just as serious and damaging as seropositive rheumatoid arthritis. Treatment decisions are typically guided by the clinical severity and progression of the disease rather than the status of antibodies alone. This understanding aligns with current medical consensus, emphasizing that while anti-CCP is a valuable test for rheumatoid arthritis, it is not definitive, especially in seronegative cases. Comprehensive clinical assessment remains vital for diagnosing and managing seronegative rheumatoid arthritis effectively.